All right, let's get right into it. Today, we are tackling a topic that, let's be honest, is a huge source of anxiety for so many new moms. But it's one we absolutely have to talk about openly. We're talking about that very first postpartum trip to the bathroom. And this whole explainer is designed to be your guide to a fearless recovery. And let's just start right here with this powerful, reassuring truth. That fear you might be feeling, it is 100% real. It's valid, and it is so common. But it does not have to run your recovery. The entire goal here is to replace that fear with a clear, science-backed plan of action. So to really conquer that fear, first we have to understand where it's even coming from, what's actually going on inside your body. The good news is it's not permanent damage. Just think of it like a few temporary and totally predictable glitches in the system. Okay, so what's going on here? Your body is basically dealing with two different issues at the same time. On one side, you've got the bladder, which we're calling the numb balloon. See, all that intense pressure from the baby's head, plus the effects of an epidural, can temporarily stun the nerves, so your brain just isn't getting the memo that you need to go. Then on the other side, you've got the bowel, the stalled engine. This is slowed down by postpartum hormones, you're likely dehydrated from labor, and those iron supplements can make stool harder. And on top of all that, there's a very real fear of your stitches, which makes you clench up without even realizing it. You know, that numb balloon effect actually has a medical name, neuropraxia. Now, it sounds pretty serious, right? But the key word, and I really want you to hear this, is temporary. The nerves aren't damaged or broken. They're just, well, they're asleep on the job after the absolute marathon of delivery. They just need a little bit of time to wake back up. And for that stalled engine, there's this huge psychological piece that comes into play. It's called the guarding reflex. This isn't you consciously deciding to hold everything in. It's your brain's primal protective instinct kicking into high gear. It subconsciously clenches everything up tight to protect your stitches. Your own mind is literally creating a physical roadblock, all because of fear. Okay, so now we get the why. So let's talk about the how. We're moving into the really practical part of this whole thing, a 6-rule protocol. This isn't just guesswork. It is a measurable, clinical action plan to give you back complete control of the situation. Rule number 1 kicks off with a non-negotiable deadline. You must urinate within 6 hours of giving birth or having your catheter removed. And this isn't just about comfort. A bladder that gets too full can physically prevent your uterus from contracting properly, and that can lead to a really dangerous condition called postpartum hemorrhage. So the key takeaway is this. Don't wait to feel the urge to go, because with those nerves still waking up, that urge might not come. Now, what if your bladder is being a little shy? Here are 3 proven sensory tricks to help it along. Just the sound of running water from the tap can help. Spraying warm water over the area with a peri bottle not only feels amazing on your stitches, but that temperature change helps your muscles relax. And here's a fantastic pro tip. Blowing bubbles through a straw into a cup of water. It sounds kind of silly, but the specific gentle pressure it creates in your core has this fascinating direct line to relaxing your pelvic floor muscles. It really works. Let's move on to rule number 2. This slide perfectly shows how our modern toilets actually work against our own anatomy. When you sit at a 90-degree angle, it literally puts a kink in your colon, just like a garden hose. And that forces you to strain. The fix could not be simpler. Just pop a small 6 to 8-inch stool under your feet to get your knees up above your hips. This mimics a natural squat. It unkinks the colon, and it lets gravity do most of the work for you. Okay, to fight back against that guarding reflex we talked about, you're going to use what's called the splinting technique. This is rule number 3. All you do is take a clean maternity pad and press it firmly but gently against your perineum, right over your stitches. This provides physical support and counterpressure, which sends this powerful message of security back to your brain. It basically helps override the fear and tells your muscles it's safe to relax. Rule 4 is all about what you're putting into your body, and it starts with this number, 3 liters. That is the absolute minimum amount of water you should be drinking every single day. Trust me, hydration is completely non-negotiable for a smooth recovery. And here is the other half of that crucial equation, 30 grams of fiber. What's absolutely essential to get is that these two numbers work as a team. You can't have one without the other, because fiber without enough water is like trying to pass cement through your gut. But fiber with all that water, it creates a soft, bulky gel that moves everything along effortlessly. And you know, hitting that fiber goal is probably easier than you think. Here are some fantastic, really accessible options. Things like soaked isabgol, that's psyllium, or sabja seeds, ragi malt, oats, and then, of course, lots of green leafy vegetables and ripe papaya will get you to that 30-gram target in no time. Okay, rule 5 is for managing painful hemorrhoids. Please don't just try to power through the pain. Follow this simple timeline. About 15 minutes before you plan to go, apply your prescribed anesthetic cream. This will numb the area and break that awful pain spasm cycle. Then, immediately after, always use a gentle jet spray or wet wipes. Never dry toilet paper. This brings us to another really important part of your medical toolkit, osmotic laxatives. A lot of people are scared of them, thinking they'll cause cramping or that they're addictive, but as you can see here, they are not stimulants at all. They work like a sponge, simply pulling the water you're already drinking into your colon to soften everything up to, well, the consistency of toothpaste. They're incredibly gentle and perfectly safe to take while you're breastfeeding. And now for our final rule, number 6, the 5-minute limit. Straining on the toilet for a long time is completely counterproductive. It actually makes hemorrhoids worse by causing blood to pool in that area. So if nothing happens within about 5 minutes, just get up. Go walk around, have a glass of warm water, and let your body reset before you try again a little later. Okay, now that we have our action plan all laid out, let's really lock it in by taking on some common and, frankly, pretty dangerous cultural myths. It's time to see how medical science completely dismantles this harmful folklore. Oh, this is a big one, so let's be crystal clear. The myth that you should restrict your water intake is not just wrong, it is actively harmful. The reality is the exact opposite of what the myth claims. When you're dehydrated, your urine gets super concentrated and acidic, which then stings and burns your stitches and slows down healing. It also guarantees you'll have hard, painful stools, and the intense straining that causes is precisely what weakens your pelvic floor and can lead to long-term problems like urine leakage. Drinking plenty of water prevents all of this. Here's another dietary myth that just completely defies biology. The idea that ghee lubricates your insides, it sounds kind of plausible, but it's pure fat with zero fiber. For a digestive system that's already slowed down by hormones, our stalled engine, dumping a heavy load of fat on it can make things even more sluggish. Papaya, on the other hand, is a total powerhouse. It's packed with fiber for bulk, water for softness, and natural digestive enzymes to help break things down. It will not melt your stitches, it will help your gut work properly. This myth right here causes so much unnecessary terror. Your uterus will not fall out from having a bowel movement. Let's just look at the science. Your uterus is held deep inside your pelvis by a network of incredibly strong ligaments. Think of them like resilient, natural anchor cables. Now, pelvic organ prolapse is a real thing, but it's caused by the weakening of those supports over a long period of time, from things like chronic, daily straining against severe constipation for weeks or even months. One difficult day is not the cause. Our 6-rule protocol is designed specifically to prevent that kind of chronic strain from ever becoming a problem. All right, finally, while these tools are going to work for the vast majority of women, it is absolutely crucial that you know these specific warning signs that mean you need to stop what you're doing and call your doctor immediately. This is your safety net. So please pay close attention here. If it's been more than 6 hours and you can't urinate at all, even after trying the tricks, if you hit day 4 and there's been no bowel movement, if you see active, pouring, or dripping bright red blood from your rectum, or if you get that internal burning sensation with a fever, these are red flags. Do not wait. Call your medical team right away. Let's end on this note. That fear is understandable, but your body is not fragile. It is a brilliant, resilient machine. And now you have the knowledge, you have the tools, and you have the actual medical metrics to work with your body, not against it as you heal. So I'll leave you with this question to think about. Whether you're pregnant right now or you're supporting someone who is, what is one small thing you can do today to put this knowledge into action? Maybe it's just buying a footstool for the bathroom or stocking your pantry with some of those fiber-rich foods. Taking that first small step is how you begin a confident and, yes, a fearless recovery. Thank you so much for joining me.